All right. So our next question is, what are contraindications for TPN and PPN?
Yeah, so we spoke just about these patients with like visceral hypersensitivity, SMA, LULs, that technically the GI tract could be working, like it's moving, it's absorbing. So these, I would say, should not be put on TPN. Also, if you have someone that has an infected line, a fungemia, it's better for the first 24 hours not to do any like parenteral nutrition. The candida, like they love like the lipid, the nutrients. So it's good to give a break for the first 24 hours. And then we mentioned before the peripheral parenteral nutrition about how when someone needs all of his diet to be into the parenteral nutrition, they have high energy requirement. They should not be put on the peripheral parenteral nutrition for long. They should rapidly be transitioned with a PIC line and regular parenteral nutrition because it's not going to feed them enough. But yeah, of course, if you have lost all of your access because you're thrombosed everywhere, then it's not necessarily a contraindication, but we're unable to do a TPN. So then it's more like considering transplant and people like young kids that are born with some issues and then have had TPN for like most of their life and they develop a cirrhosis. We will not stop the TPN because they have cirrhosis. The good thing now is that there are some medication like Gattex, like tirzepatide, which is a GLP-2 analog that helps increasing the villi of the intestine. That can help wean some people off the TPN and help them absorb more with the intestine that they have.
Do you have a spiel that you tell patients before they go on TPN about the potential complications that we could borrow from you and adapt?
Yeah, so on one end, lots of the patients I see, I've already been started on TPN because they have short bowel syndrome, they have like intestinal failure. So these patients are okay. Unfortunately, we see lots of people with like visceral hypersensitivity, IBS that have in fact a GI tract that is still working in the terms of like motility, absorption, and then they are impatient and refusing the other options, parenteral feeding and everything. And I explain how you need to have food in your intestine for the intestine to keep working. You need to have amino acids like glutamine to feed your intestine. Otherwise, there's going to be bacterial overgrowth. There's going to be more intestinal permeability. And then the person is just going to be super bloated and super uncomfortable as soon as they start eating again. And then it will just be a bad vicious cycle with their visceral hypersensitivity. So what I tell them usually it's, yeah, that TPN is not natural. It goes straight to the liver. It causes fatty liver disease, and then progressively it can cause gallstone blockages in the liver. And that also the risk of infection down the line is quite high. And from the infection, they can have like endocarditis. They can have like full-blown sepsis because of the line. If their GI tract is still working, we really need to find a way to utilize it, thereby doing a jejunostomy, so it bypasses the stomach, and then the person is less vomiting, and work more with a neuromodulator to help with their visceral sensitivity.